Good morning. I am about 3 days short of 5 weeks post-op from my upper eyelid surgery. And just a quick look back. Overall, I'm very pleased. It went more or less how I expected. We'll talk about the problem I had in a moment. But upper blepharoplasty is one of the best things that I believe anybody can have done to look more refreshed. As you know, perhaps last October on Halloween, Dr. Hope performed a lower dot laser resurfacing, a fractionated CO2 laser for me to rejuvenate some of the tired skin, aging skin under my eyelid. Wrinkles, sun damage, men and women equally probably earn that here. We see sun damage all over the face. For women, commonly we see more in the perioral area around the lips. But regarding my eyes, so I took a look following the laser resurfacing and noticed my heavy eyelids. I've been talking about possibly doing an upper blepharoplasty, that is having it performed myself, for the past probably 18 to 20 years. And following the laser resurfacing, you know, you're looking in the mirror and it looks pretty good. It wasn't that big a deal to go through that recovery, and you sort of wanted to take the next step. And so I spoke with a good friend, and he was eager and willing to come down to assist me. So almost 5 weeks ago, I had my upper eyelid surgery on a Saturday morning. I behaved properly as I should. I went home, I used ice compresses and just relaxed. Regarding the procedure itself, I actually did this without any Valium. It can be done that way. I knew what to anticipate with the injections, the process of being in the operating room. We encourage our patients strongly to take some Valium just to take the edge off. And it helps with regards to the next thing I'm going to share. So I did go home and relax. Had I been on Valium, I probably would have slept through that afternoon, perhaps that evening. In my case, I did something I shouldn't have done, and that is I went out to dinner with my surgeon, and about 4 a.m. my eyelid dehisced, it opened. That required me to come back. The entire thing opened. Sometimes we can see an incision dehisce or open. We give instructions like be careful dressing and undressing, like pulling these scrubs off would be a very difficult thing because I might pull my eyebrow. Getting out of the shower and drying our hair, we can pull our brow up, just simply washing our faces. So it's something that typically we are all very cautious about initially because we can feel we've just had something done. It's swollen, it's tight, and we know we're trying to be careful. Not commonly, but when things dehisce or open, it's often after the suture removal. So it's 6-7 days later, suture comes out. It's that time that it's a big milestone, and we feel that it's sort of a celebratory time. And now we're pulling our clothes off, or we're drying our hair. We sort of forget we're working out again, sweating, wiping the sweat, and things dehisce. If that occurs, often there's a small little area that opens, and we usually just use a little bit of ointment, a little bit of Aquaphor over the area. It generally isn't a major problem and takes a few extra days. It's not totally convenient, but it's fine. In my case, it opened less than 24 hours later, and the entire incision opened. So I contemplated just using ointment every day, but I did have some meetings and some travel planned, and so I was up against a little bit of a time crunch. So I thought to myself, all right, well, let me try to get back to the office, and I thought I could probably set up some mirrors and figure out how to get things closed myself. Fortunately, my facial plastic surgeon was available before he got busy and took off, and came back at 7 a.m., put a few sutures in, and we moved forward. There is a difference, even almost 5 weeks out, between the left eyelid here, which is still a little bit pink, a little bit raised still, and the right eyelid. So there's a delay. I know it's going to get better, but there is a difference secondary to the incision dehiscing. Some of the things that I've learned during this time is that it's definitely noticeable. First, it's very numb, which is just sort of a weird feeling. You go to just touch your eyes and your lashes are numb. There's certainly some swelling. I feel I looked a little bit odd, a little bit maybe feminine initially. The lids themselves are thicker. They're more edematous and swollen from the incision down towards the lash line. And so I always tell patients every day, every week, every month it continues to improve, and indeed that's exactly what occurs. But going through that period of time and having perhaps a little bit of a hesitation, especially with this left eyelid, there was a little period of time where I was sort of wondering, was this the result that I hoped for? Of course, I knew it would be. I was confident. But even with that confidence, knowing what I know, there was some uncertainty. And I think that that's something that we really strive to educate patients about through other patient videos, whether or not it's facelifts or lasers or eyelids or whatever we're doing, rhinoplasty, whatever we're doing. We try to set realistic expectations. And I think a lot of our patients do view these things. However, when you're the patient, 3 or 4 days feels like it's been several weeks already, and you start questioning the uniqueness of what's going on with you. So that was one thing, that despite me knowing all this and anticipating it and being ready, there was a little bit of a hesitation and frankly a little bit of loss of some confidence in, did I make the right decision? Obviously, as things started to improve, that went away. With regards to people knowing, a lot of the concerns that I have, particularly with men, are, I don't want it to look noticeable. And there's a double-edged sword there. One is, you don't want it to look noticeable, like people are talking about you, like, look at what he did, or look at what she did, or look at how funny they look. That stereotypical plastic surgery sort of thing. Most patients realize that following these procedures, you're going to look like you've been maybe operated on or at least different than you did before, clearly. What was very interesting to me, and I don't see my family often, but I've got 2 brothers and a sister. I saw all of them with their significant others. I saw both of my kids, which is unusual also. And many patients, of course, that I've shared with. This was on the news. Liz Bonus covered it as men in plastic surgery. So it wasn't that I was hiding it. It's just that I didn't say anything to my family. None of them noticed, which was remarkable. My older brother did make a comment one day. He sometimes complains about things about himself. And he was complaining about, I don't know, his eyes or how tired he looked, just out of the blue. We were having some popcorn, actually, at a bar and just talking. And he looked up at me and he says, your eyes look really good. This was less than a week. This was probably about 10 days following the surgery, actually. The sutures had just come out. So that was interesting to me, is even the people closest to you don't recognize it. As I look back on photos and I see my eyelids were okay, this wasn't a major problem for me. It's something I'd considered. It's a slowly evolving process, but I'm thrilled that I had it done. When I look at myself now, despite the beard, there are some changes that are very positive. My eyes just look brighter. Between the laser and the upper eyelid surgery, I think that this is something that so many people would benefit from, and I'm really glad that I decided to do this. With regards to how I felt, there was some irritation. It wasn't really a dry eye. I suppose it was a dry eye. What happens normally is that our lacrimal gland is up here, and when we blink, tears go over our cornea, draining into the puncta in our lower eyelid, into our nose, into the back of our throat. Well, for any reason, if it's a laser, if it's a surgery, if it's trauma, if there's swelling, if there's anything that delays that eye blinking, that closure, then that tearing mechanism can be affected. And even though I didn't have significantly dry eyes, there was one night in particular that I did, and I used the lacquer lube. I used ointment overnight. It felt so much better in the morning. And I did use some drops intermittently during that first and second week. So that was something that I didn't think. Perhaps allergies exacerbated it, just with the time of the year. But regardless, those are things that we provide for patients, and I would say that that's an expectation that if you really pay attention to it, there's going to be a little bit of irritation, a little bit of dryness. It felt good for me simply just to hold my eyes up like this so that the puncta in my lower lid would sort of capture the tears, so it just felt good to close them and bathe my eyes in lacrimal fluid or tears. So that was, I didn't recognize that would actually be a problem. There's so many patients that I treat that just sail through this thing. I mean, there are zero complaints. They really, literally have no issues at all. So I thought that maybe there was something unique to what was going on with me. Overall, if you asked me would I do this again, I probably would have done this at least 10 years ago. I know I've been talking about it for almost 20. It wasn't a high need for me, still wasn't, but I'm really, really glad I did it at this time in my life. I'll get to enjoy the results really for the rest of my life, and I just feel better about myself.